Factitious fever is a complex and puzzling condition. It falls under the umbrella of factitious disorders. In these disorders, individuals deliberately act as if they are sick. They may even injure themselves to support their claims. Factitious fever specifically involves faking or inducing a high temperature. This is not about seeking attention or external benefits. These individuals are driven by a deeper psychological need. This essay will delve into the intricacies of factitious fever. We will explore its prevalence, symptoms, and the underlying psychological factors. We'll also examine the challenges of diagnosis and the importance of a multifaceted treatment approach. Factitious fever is a serious condition. It requires understanding and empathy. By shedding light on this disorder, we can improve awareness and support for those affected. Let's work together to unravel the complexities of factitious fever and promote informed discussions about mental health.
Factitious fever is relatively uncommon. However, it is crucial to be aware of its existence, especially in certain settings. This condition is most often seen in young adults. Interestingly, there seems to be a gender bias, with females being more prone to it than males. Studies suggest a possible link between medical knowledge and factitious fever. Individuals working in healthcare settings, or those with extensive medical knowledge, might be more likely to develop this condition. This could be attributed to their familiarity with medical procedures and their ability to manipulate them. However, it's important to remember that anyone can develop factitious fever, regardless of their age, gender, or profession. The underlying reasons are complex and often stem from deep-seated psychological issues. Identifying factitious fever can be quite challenging. Individuals with this condition are often skilled at manipulating their symptoms and deceiving healthcare professionals. They may present with a convincing story about their illness, complete with fabricated details and exaggerated symptoms. Some common methods used to induce fever include self-harm. Patients might deliberately injure themselves to cause an infection. Heating devices. They might use heating pads, hot water bottles, or even light bulbs to artificially raise their temperature readings. Tampering with thermometers. Some individuals may manipulate thermometers to display a higher temperature. Contamination. They might contaminate their own samples, such as urine or blood, to mimic an infection. Recognizing these deceptive behaviors is crucial for accurate diagnosis and appropriate treatment.
Section 5. The Diagnostic Maze. Challenges for medical professionals. Diagnosing factitious fever presents a significant challenge for healthcare professionals. The deceptive nature of the condition, coupled with the patient's convincing performance, can make it difficult to separate truth from fabrication. Here are some red flags that might indicate factitious fever. Inconsistent medical history. Patients might provide conflicting details about their medical history or have a history of seeking medical attention at multiple hospitals. Unclear or changing symptoms. Their reported symptoms might not align with objective findings, or they might frequently change their story. Eagerness for medical procedures. They might be overly enthusiastic about undergoing tests or procedures, even invasive ones. Reluctance for psychiatric evaluation. Patients with factitious fever often resist any suggestion of a psychological evaluation. Early identification is crucial to prevent unnecessary medical interventions and potential harm to the patient.
Section 6. Navigating treatment, a multifaceted approach. Treating factitious fever requires a multifaceted approach that addresses both the physical and psychological aspects of the condition, ensuring a comprehensive treatment plan. The primary focus is on addressing the underlying psychological distress that drives the behavior, which is often deeply rooted. Psychotherapy, particularly cognitive behavioral therapy or CBT, is the cornerstone of treatment for factitious fever, offering structured support. CBT helps individuals identify and modify negative thought patterns and develop healthier coping mechanisms, which are crucial for recovery. Family therapy can also be beneficial in educating loved ones about the disorder and fostering a supportive environment, which is essential for long-term success. Medications might be prescribed to address co-occurring mental health conditions, such as depression or anxiety, which often accompany factitious fever. However, it's important to note that there are no specific medications to treat factitious fever directly, making psychotherapy even more vital. Treatment requires patience, empathy, and a strong therapeutic alliance between the patient and healthcare professional, which can significantly enhance outcomes. It's a journey of healing and self-discovery, aimed at empowering individuals to break free from the cycle of deception and embrace healthier ways of coping with their emotional needs, ultimately leading to a more fulfilling life.
Section 7. Case Studies. Real-life examples of factitious fever. Real-life cases of factitious fever can provide valuable insights into the complexities and nuances of this condition. They highlight the challenges of diagnosis, the importance of timely psychological intervention, and the potential consequences of untreated factitious disorders. One such case involved a young woman who repeatedly presented to the emergency room with alarmingly high fevers. Despite extensive and thorough medical investigations, no underlying medical cause for her persistent fevers could be identified. Eventually, it was discovered that she was deliberately injecting herself with contaminated water to induce infections and fevers. Another case involved a middle-aged man who fabricated a detailed history of chronic fatigue and low-grade fevers. He claimed to have tried numerous treatments without success, and insisted on undergoing a battery of unnecessary and invasive tests. It was later revealed that he was secretly taking medication to suppress his own immune system, thereby causing his fevers. These cases underscore the critical importance of maintaining a high index of suspicion for factitious fever, especially when dealing with patients who present with unexplained symptoms or a history of seeking medical attention at multiple facilities.
Section 8. Ethical Considerations, Balancing Care and Deception. Factitious fever raises several ethical dilemmas for healthcare professionals. On one hand, they have a duty to provide care and alleviate suffering, ensuring the patient's well-being. On the other hand, they must balance this with the need to address the patient's deceptive behavior, which complicates the treatment process. One of the main ethical challenges is determining the appropriate level of intervention, considering both medical and psychological aspects. While it's important to identify and address the underlying psychological issues driving the behavior, healthcare professionals must also be cautious about colluding with the patient's deception, which can be challenging.
Another ethical consideration is maintaining patient confidentiality, which is crucial in all medical settings. Factitious fever is a mental health condition, and patients have a right to privacy, which must be respected. However, there might be situations where disclosing the diagnosis to other healthcare providers involved in the patient's care is necessary to prevent unnecessary or harmful interventions, ensuring patient safety. Navigating these ethical dilemmas requires sensitivity, compassion, and a commitment to open and honest communication with the patient, fostering trust and understanding.
Section 9. Conclusion, Early Identification and Holistic Care. Factitious fever is a complex and often misunderstood condition. It's not about attention-seeking or malingering. It's a cry for help, a manifestation of deep-seated psychological distress. Early identification and intervention are crucial to prevent unnecessary medical procedures and guide individuals towards appropriate psychological support. Healthcare professionals play a vital role in recognizing the red flags, navigating the diagnostic challenges, and providing compassionate care. By fostering a collaborative and trusting relationship with patients, we can help them understand the root causes of their behavior and empower them to seek healthier ways of coping with their emotional needs. Factitious fever is a reminder that mental health is just as important as physical health. By increasing awareness, promoting understanding, and advocating for comprehensive mental health services, we can create a more supportive and compassionate environment for those struggling with this challenging condition.